Okay, I think we are now live. So are we okay to get started? Welcome everyone to this session on engaging young people for better outcomes, why we need to change the way we work. I'm really excited that everyone's here. Just to give an overview of how we're going to run today's session, we're going to do some quick introductions of our speakers, and then we'll run through a few slides to give some information and background. And then we're really excited to have some discussion and have some questions from participants. So just a few housekeeping items. We have found that the chat box is the best place to put anything. So please, if you have questions, we'll be monitoring that. So feel free to put your questions in the chat box. And I think that's it. My name is Megan Greeley, and I'm really delighted to join you all today. I am a nurse practitioner by background and really typically practice primary care here in Baltimore, Maryland, in the US. And I also work for an organization called Jhpiego, and I am a technical advisor on adolescent health. So support our organization in work with adolescents and young people across the globe. I'm going to turn it over to Munashi to introduce himself, and then to Peter.
Sure. Thank you so much, Megan. So my name is Munashi Nyika. I'm a young nurse from Harare in Zimbabwe. And I'm a young nurse representative on the board for Nursing Now. And it's great to be on this session.
Thanks, Munashi. Peter?
Good day, everybody. Good afternoon, good morning. My name is Peter Johnson, and I am the Senior Director for Nursing and Midwifery at Jhpiego, the same organization that that my colleague Megan just described. I am both a nurse and a midwife, a certified nurse midwife here in the U.S. And I am also, I think I'm recognizable as Munashi described himself as a young nurse. I would describe myself as an old nurse. So I'm really happy to be here and provide perspective.
Great. Thanks so much to both of you for being here. And so we also wanted to learn a little bit more about the participants today. So we have a couple of poll questions just to get us started. So I'm going to launch, oh dear, my poll questions are gone, but we can easily add those in. So we are going to ask, first of all, if you are over 30 or under 30. We wanted to get a feel for the age of the participants today. So hopefully if this, oh look, and now I have, okay, so let's see, launch poll. Sorry, getting used to this technology. It's open now. Hopefully you should see a poll and just take one moment to answer that. And I'm not seeing the answers coming in.
I am. I'm seeing 3 people 3 people said they're under 20 and 12 people over 20, so, or over 30.
Okay, great. I'm glad.
Vast majority of folks here joining us today are, including ourselves, are over 30.
Yes. Okay. And one other quick question. So this one is, did you or do you feel empowered and encouraged to take a seat at the table as a young nurse? So this is a bit about this is really the crux of what we're talking about today. So we wanted to just get a pulse of the audience of what your experience has been or is. And I can't say the responses. So Peter, if you or Minashi can let me know if they're coming in. Are we having more yeses or more nos?
I will tell you, about half and half right now.
Okay.
We have 12 responses, 58% say yes, 41% say no.
Great. So, a mix of responses, and that's not surprising, I think. And so I think it's good to just keep in mind our own experience as professionals as we're talking about this topic today. So we're going to try to advance our slides here. So just to set up some of the background about what we're talking about youth engagement and young people in the work that we do. And Jhpiego works, a lot of our adolescent and youth work is in the sexual and reproductive health space. So that's some of what our framing is around this. We know that the global health community has really made some progress in engaging adolescents and youth. But we also know that much of that engagement is still fraught with challenges, and that there's a lot of ageism and tokenism that exists. And often young people feel that adults are not really willing to engage them in meaningful ways and really value their full participation. That oftentimes when we do engage young people, it's more from the idea of this moral imperative where you have to because it's the right thing to do, so you do and you check that box. Not from a place where we see the value of what young people have to contribute and how their participant changes for the better the outcomes that we're trying to reach. And I will say that we've seen this as well in our direct consultations with young people and the work that Jhpiego does, that often young people say they are invited to high-level meetings, but they might be given a note-taking role, or they're not given a chance to speak, or they're not given opportunities to input to the agenda, and they're not given any roles in follow-up. That even if they are given a chance to voice the concerns that they have or give a perspective of young people, that those ideas aren't carried forward. And so we continue to hear that there are challenges out there. And some of the work that has been done to set some standards for meaningful engagement includes this global consensus statement that was put out a couple of years ago, and Jhpiego is one of the members, the organizations that has signed on to this consensus statement. And I find this a very helpful tool to have. This really outlines what engagement with adolescents and young people should look like, that there are these ideas that it's rights-based, it's transparent and informative, voluntary and free from coercion, respectful of backgrounds and identities, and that it's safe. And included, there's a link here for this statement, and included at the end of the statement is a checklist that actually gives some very concrete ideas for what organizations can do to engage meaningfully with young people. And it's something that I use routinely in my work to think through what that should look like. And one specific area that we've seen a lot of growth and a lot of impact from the work that Jhpiego does is supporting young people in youth-led advocacy efforts. And we have really found that when we're strengthening young people in their advocacy skills, but also their leadership skills, things like communication and empowering them to be able to engage, and then giving them some continued support to develop and implement action plans, we really see that they're able to be quite impactful, that they can influence agendas, that they can mobilize resources, and that there's a strong accountability piece to the work that they do. So I'm going to hand it over to Peter to talk about the State of the World's Nursing.
Thank you, Megan. So the State of the World Nursing report was released on April 7th. It was there was inputs from 191 WHO member countries. So it's actually a very comprehensive report. And the report certainly was not silent on youth. It was framed around the themes of education and employment and leadership. And certainly there are elements of education and elements of employment and the elements of leadership that are key to youth engagement. So one of the things that really is very clear is that nursing has a long way to go if we're going to meet the SDGs, if we're going to have the impact that we need to have, that we should have in addressing the SDGs and providing universal health coverage goals by 2030. So we're entering a decade where hopefully there will be lots of attention on nursing and lots of opportunities for us to do things that we believe make sense, that based on evidence moving forward. And one of the things that was very concerning is that youth do not see nursing necessarily as their most attractive first career choice. Many young people inside and outside of nursing, when asked, or many people inside of nursing, when asked young people, they say they went into nursing because it was, because it was a job, because it was. It provided reliable employment, but not necessarily because they were excited about it, or it was they were following a passion that they had and wanted to pursue. We really want to shift this around. We want people going into nursing not because they can't get into another career choice, but because they really see nursing. They value the work that nurses do, and they want to spend their life doing that work. I think right now there's still a lot of misinterpretations of what it is that nurses are and the work that we do. I think oftentimes that antiquated vision of what nurses are is still what's promoted. Nurses working in a hospital facility, nurses at the bedside. There's nothing wrong with that we should be proud of that being what we do. But nursing in the future is going to be much more about leading the health of communities. I was talking to a colleague yesterday here in the U.S. who was telling me that she's doing work in public health centers in large city in the U.S. and did not realize, even as a nurse with an MPH or master's in public health, how much of the public health system is staffed and led by, not just staffed, but led by nurses. So that we have to be able to articulate to youth a clear vision of what nursing is as a career that provides opportunities for leadership, that provides is a cool thing to do, a thing that's going to keep you. It's going to be valuable for a life. One of the things that I learned from early on, and probably shaped my entry into my career as a nurse a long time ago, was that I realized quickly that that becoming a nurse still allowed me lots and lots of opportunity to move in different directions. I didn't have to decide what I was going to do for my whole life. I decided, I knew that nursing was a home that would provide me so many opportunities for growth. One of the things I think is important here is that the nursing profession is not immune from the stigma, tokenism, ageism that we see that Megan just talked about. I certainly see it in nursing. I wonder why. And one of the things Megan and Menashe and I were talking about yesterday was, is it because nursing in itself feels so disempowered? Because nurses, as a female engendered profession, and again from State of the World Nursing Report, 90% of nurses around the world are female. A little less than that in your region, Menashe, where it's about 70%. But if I think we can't deny some of the the double whammy that goes along with disempowerment of young people and also disempowerment of women, and we need to be thinking in those ways. I think one of the things to explore is what are the set of things that are keeping keeping nurses that are leading the profession from really providing young people that seat at the table, and how do we do a better job? What strategies have worked elsewhere? Some of the expertise that Megan has in youth advocacy. How do we infuse that and bring that to the nursing challenge? So one of the things that's very clear and we should be excited about is the State of the World Nursing Report. Very, very explicitly calls for investment in youth advocacy, bringing youth into the profession. I think there's a recognition if we don't do that, we're not going to have a strong profession and we will not achieve the goals. We're entering into a window where we're moving from the report to a policy dialogue that will result in investments or will advocate for investments, and I believe will result in strong investments towards nursing. We need to make sure that youth investment is a part of those dialogues, and that there are tangible activities moving forward, smart objectives that are aimed at getting youth into the profession and keeping youth in the profession, in our profession for their lifetime, and making sure that they have all the opportunities to grow that they need. The other last thing I'll say is that the State of the World Nursing also highlights the need for collaboration. So one of the things that nurses are really good, one of the things that we as nurses are really good at is talking to each other. Judith Shamian, the past president of the International Council of Nurses, said many times, we need to get out of our bubble. And it's great for us to take leadership, but not if we're just taking leadership within nursing and talking to each other. We need to get out there. We need to be part of health systems. So the young people here that are, listening in, I encourage you, think about how you can get on the nursing, how you can get nursing on the agenda and your voice as a nurse into the broader dialogue. Two things I'm going to say about this before I finish, Megan and Menashe, and that is, one is just locally here, I live in the state of Maryland in the United States. And, like everybody, well, particularly we in the US have been grappling with the COVID pandemic. And the governor of our state had established a task force on reopening our economy. And there were 19 members of that task force, and 15 of them were medical doctors, were physicians. There was not a nurse to be found, in spite of the fact that one of the populations at greatest risk for death and disability from COVID are elder people that are in long-term care facilities that are owned, managed, and staffed by nurses. So this has to change, and it's only going to change if, again, we get out of our bubble and get into the greater populace of leadership. So I will stop there and turn it over back to Megan and to Menashe.
Yeah, Munashi, I think we're turning to you.
Sure. Thank you so much, Megan, and thank you so much, Peter, for that as well. And really, I think the title of this session really highlights a lot about what today is about, with the Nightingale Challenge, and talking about engaging young people, how to engage young people, and to make sure that when young people are engaged, it's meaningful engagement. So it's really great to be able to have everyone on the platform today and really talking about young people. Young people right now are both current users and implementers of health globally. And sometimes in local and national programming, it seems like young people may get overlooked when it comes to discussions around policy and how really they can be able to engage in these discussions. Young nurses, particularly, are also a key group of people who are able to also give valuable ideas and innovations as well with regards to global health and solutions within global health. But sometimes it's like we're not brought to the table to be able to give ideas and to be able to highlight some of the solutions that we feel we can be able to provide. So, really meaningful engagement of young people and young professionals is key to ensuring that programs are really inclusive, and also to ensure that we are able to have programs in global health that are really effective, particularly programs that involve those young people. Like Megan, you are highlighting issues to do with particularly sexual and reproductive health, and also particularly as well mental health in some cases. There's also a lot that young people can be able to do in being able to highlight initiatives within that area. I think right now, particularly with COVID-19, there has been a lot that has come out, and it has also brought out a lot of opportunities for engagement of young nurses. I was actually talking to a number of young nurses last week, and it was amazing hearing about how young nurses are engaging with COVID-19, because young nurses are actually at the forefront as well. They've been brought to the forefront and are responding to this global health emergency. And now it's looking at what is the best way to be able to support these young nurses that are at the front lines. How are these young nurses engaging with the health system? It's already a big challenge coming from nursing school and moving into the professional world. But now, moving into the professional world at such a time as COVID-19, what are some of the challenges young nurses are facing in as being a nurse at this time? And how can we be able to support them? Also, looking at their careers. How do young nurses want to develop their careers? And how can young nurses be able to seek the mentorship and leadership to be able to lead the point that they hope to reach? So there really is a lot of opportunity for us to be able to support young nurses and engage them meaningfully in programming.
So thanks, Menashe. And I think, yeah, you're just really highlighting that we've had lots of opportunities, but this is yet another opportunity during this COVID time to really use this as an opportunity to help shift that the view of nursing, and that we as nurses can pair and work with young people to ensure that we're both meeting their needs as key users of healthcare, and also that we're building this positive view of nursing. In the space that I work, which is really mostly adolescent sexual and reproductive health, this is also a key time to ensure that we're not ignoring young people's very significant that they have significant needs during this time as well, and that we don't ignore that and lose the gains that we've made. We'd love to. We have some discussion questions that that we can discuss ourselves, and also would love to be hearing thoughts from you all. I think that the something that's interesting about this space is that we don't have all the answers, so that it's about all of us really thinking about it. There's an opportunity for all of us to have ideas and to make decisions about how we can shift. So really interested to hear from participants as well, either as a young nurse or a young person, what you feel is important, or as someone who's older and perhaps can be someone who's reaching out and engaging young people. I think we all have a role to play in creating systems that that will sustain this over time. So I'll shift to our discussion questions, and it seems like the chat has already there've already been some thoughts in the chat as well on some of these questions, but first maybe we'll tackle what factors are keeping young people away from the nursing profession. And I saw some of the participants mentioned things like the negative vibes around nursing, and I think reiterating some of what Peter was saying about how we treat younger nurses. So would love to hear Munashi, perhaps maybe you could start with factors that are keeping as the youngest on our panel, the factors that are keeping young people away from nursing, and happy to hear from others as well.
Sure, definitely. So I think one big factor that keeps young nurses, young prospective nurses, from entering into the profession is really about the image of nursing within society. And I'm really grateful for Nursing Now, because with Nursing Now, what has happened is there's been a shift in terms of the image of nursing and in raising the status and profile of nurses within countries. So that has been really a big challenge, particularly. I can speak to my own experience as a young high school student and moving into nursing as a profession. Initially, when I did move into nursing, there was a lot of questions that were highlighted amongst peers, amongst other leaders, old school teachers, and they were asking, well, why do you want to be a nurse? And it was actually a very interesting question for me as to why I was getting quite a lot of questions from people as to why I wanted to become a nurse. And really what I shared at that moment is why I felt I could contribute to society in this way. And I feel in a lot of ways, that's what we need to be able to support. That's how we need to be able to support young prospective nurses in being able to bring out this passion that we have for the profession and for health in general, and looking at how we can be able to engage them within the system in showing and highlighting all that nurses do and all that nurses achieve. So I think in terms of image is a big factor, a big drawback factor in terms of young prospective nurses getting into the profession.
Megan, thank you, Munashi. If it's okay if I build on that, there's an interesting thread that's occurring here, started by my friend and colleague Bongi. Says as nurse leaders, we must make it our priority to create environments where young nurses and midwives can thrive, feel valued and supported. Their curiosity and innovation should not be stifled if we want to serve our communities well. Let's not eat our young. And there's many people that are responding, saying that that they're in concurrence with that, and they're that kind of phenomenon that I think we meant yesterday about nurses eating up their young. I'm wondering if this, in some ways, reflects the disempowerment that we have felt as a profession. And one of the statistics that I was struck by recently was that nurse leaders, as they move out of the bubble and they go into other leadership positions in health systems, oftentimes fail to identify themselves as a nurse, whereas physicians and other healthcare providers wear that proudly. You are a physician that's a CEO of a hospital, and whereas a nurse is encouraged to kind of forget their nursing roots, not talk about it too much. So I wonder if we're hanging on to power within our own sphere, because we don't feel like frankly, I wonder if it has something to do with of many of us entering the profession over time at a time where it wasn't our first choice, and that's something that I think desperately needs to be changed as we present this as an option to the next generation.
Yeah, Peter, I think it's really important. I think it's a complex issue. So there's lots of factors. I also think that sometimes, and Munashi, I'd love to hear your perspective on this as well, is that sometimes what I hear is people say, oh, well, young people, but they don't have the experience and knowledge that's needed. And I think what we try to do in our work is be very upfront about that. We are not saying that young people might not have 30 years of technical experience, but that doesn't mean that they don't have things to offer. And I think that we need to be thoughtful about the variety of skills and factors that are really important. And that I think, Munashi, you were speaking to some of them, that even things like ability to engage with different populations in communication skills. I think certainly in terms of technology, younger people are often coming with greater digital skills. I think that we need to remember that there's many different ways to contribute, and people can bring different value.
Yes, definitely. And I think the way you highlighted, Megan, it's exactly as it is, in that despite us having very little experience as young nurses, we still have quite a lot to offer. And I think that's something that is quite overlooked a lot of the times, particularly in terms of how to be able to have young nurses contribute within discussion. It's sometimes a problem in that young nurses can be brought to the table, but despite being at the table, it's like their opinions aren't really valued or aren't really taken as implementable aspects. So I think that's also a challenge that we do face, and something that also would be great to be able to highlight. And as you say, like, there are a lot of areas and a lot of situations where young nurses actually do have a lot of experience as well. So particularly as well in aspects of technology, in aspects of looking at new innovations. We've got a lot of ideas as well as young nurses that would be great to include, and that we are already implementing sometimes within our own communities. And these ideas are actually working. So sometimes what we lack is actually the space to be then able to present these ideas and say, well, this is something that I've been doing and it has been working. How can I be able to present it so that other people can be able to use it in other situations? So I think that is generally a big draw factor as well.
Yeah, and it looks like maybe this is, Elizabeth has a comment here in the chat that maybe we should have reverse mentorship between young and senior nurses, bearing in mind the young will one day in the future be the senior nurses. So, and maybe getting to this next question, if we kind of shift to what can we do, what are the strategies we can use? what can we use perhaps both on a personal level and a more system level to make space for younger colleagues? This idea of reverse mentorship, it would be interesting to see what that would look like. Also, I know that there was a comment earlier by Nabina thinking about this idea of changing the view of nursing, and that if we that kind of this idea of giving and selfless nurses is not necessarily the most appealing, that you would enter a profession to just give yourself all away, and that maybe if we include financing, economics, investment, money dynamics, that that young nurses can develop a mind in leadership policy and a sort of entrepreneurship. Do we have other ideas? Peter, I don't know if you have any thoughts. You've mentioned some already, or Menashe, but certainly love to hear from participants' ideas as well that we can all do.
Yeah, I would say please keep the participant ideas coming here so that we can pick up on them. Many of them that I've seen so far really resonate with me. One of the things that I think it's important for elder nurses to do, probably all nurses to do, but particularly elder nurses need to practice how to stay quiet and how to listen. I think that in a conversation of young nurses, or when young nurses are here, we need to be better able to give them the space to explore, to not take over that conversation because we have so much more years of experience. The fresh ideas presented, I think, are incredibly valuable, and I've seen so many times those conversations get cut off because we can be dominating, we can be threatening, and I think we can, even without saying it, just our actions can send the message. And Menashe, check me on this, but I would think that our actions could just send the message that you really don't know what you're doing. You're new to this, and just watch us and follow our lead. And that's what we did. You're going to have to do the same thing.
Yes, true, Peter. I was actually laughing when you were saying that, because I think I've also had a similar experience at some point in time where that has been the situation. And what I think it also comes down to, it also is a conversation of how we support each other as nurses, whether young, whether old. How we are able to interact between each other, and how we can be able to get each other to support each other in being able to achieve the goals that we want. So yeah, I can totally identify with that as well. And I am really excited as well by the comments that are coming in the chat on skills that young nurses would be great to develop within their education. So also looking at aspects of entrepreneurship, how to develop young nurses as entrepreneurs, how to be able to get young nurses thinking about different ideas, and how to develop skills in aspects such as advocacy as well. I think there are a lot of areas that we can be able to get and develop training for young nurses in being able to engage them more and get their ideas as well in being able to develop programs.
Yeah, and I think maybe even some practical steps we can take in our daily lives is just starting to be aware of this issue. I think, and perhaps as an older nurse, or you can put out an olive branch, if you will. Being aware of age when we're thinking about things like committees or thinking about how decision making happens. Seeking the perspective of younger people. And I think as perhaps some of the comments have gotten to is also being open to admitting that open to this idea that other people have things to add. And so I think sometimes there's this sense of like, no, I have to prove that I am the expert and I know everything. But I think that someone made the comment that we need to acknowledge that healthcare is evolving and things are changing. And so being kind of open to ideas is something really important.
I think another thing that really is important strategically is just challenging all nurses in the profession and young nurses in the profession too, to champion the people, students and nurses that are entering the profession, and perhaps even championing those people, young people that we think might be might be people that we would want to really think about entering the profession. We need to be able to sell ourselves to people, and I think one of my colleagues was talking to me recently about the difference between mentoring and championing, and saying that that the champion goes above and beyond in making sure that they are not just identifying opportunities, but helping to match an individual with the individual they're mentoring with those opportunities, bringing them along. So if you're a nurse researcher, finding people and providing them with opportunities, young people to do nursing research with you. If you are an administrator looking for that young student nurse that really seems to have good organizational capabilities starting out. A lot of people that are going into nursing here in my country are coming into it as a second career choice, and they may have extensive careers in other things and bring skills that could be leveraged towards nursing. So finding those kinds of things and actually matching them with the opportunity, I think that's critical.
Yeah, thanks, Peter. Maybe we only have a few minutes left. The time goes quickly here. But maybe we could shift to this last question about the current COVID pandemic. So Munashi talked a bit about this before, but would love to hear more thoughts on how the current pandemic has impacted young people in nursing. Are there opportunities within this? Is this an important time because it's a deterrent for young people to enter nursing, certainly as a high risk area. Would love to hear thoughts and hear what's happening for participants around the globe. Or Menashe, maybe you could give us some perspective. I know you've been doing a lot of thinking on this lately.
Sure, thank you, Megan. And I think definitely we do have a big opportunity at this time of COVID, in being able to engage young nurses. And I think as we do that, we really need to think about what is the best way in being able to do so. So particularly right now with COVID-19 around the world, there has been a lot of conversation on how exactly young nurses can be able to engage. And really, particularly right now, as we are moving into this period where lockdowns are being lifted, and there is this new normal that is being talked about, and how to be able to transition into that new normal. What are some of the ways young nurses can be able to support? And what are some of the challenges that are already being faced? What are some of the challenges that young people who are in communities are already facing in accessing healthcare? And also, how can we be able to get young nurses to support that and provide solutions to that? So I'm really excited today, particularly because later this afternoon, we're going to be launching the Nightingale Challenge Global Solutions Initiative, which is really going to be an amazing platform. And I really hope that all the young nurses who are on this session actually do sign up for it. It's going to be a Facebook group where we are going to get young nurses and young midwives to come together and start talking about solutions, start talking about what can be done, and really to create a space on being able to get some of these opinions coming in. So it's really going to be an amazing initiative, and we'll talk more about it later on in the session in the afternoon.
Yeah, thanks, Minashi. I think that's a really exciting concrete next step people can take to really be part of this solution. Also, I feel like it's important to mention that in so much of the work that I support, we continue to see that young people don't feel that they're receiving healthcare in a respectful, judgment-free manner. And that's discouraging, that's challenging just in meeting their actual health needs, whatever those might be. But I think it also does play a role in this, general idea of when you think about who do you want to be when you grow up, who do you look to in terms of role models, and so I think we also need to consider that in our every interaction, we have an opportunity to help inspire a future nurse. I think it's something that we should all take seriously, that treating young people in our work, that when we see them as patients or clients, that this is an opportunity as well to shift the conversation. And even just in our general lives, we were talking yesterday, and we were talking about how we interact with our own families and try to change the conversation a bit, in terms of encouraging small children to think about, you could be a nurse when you grew up. There are lots of opportunities in throughout our personal and professional lives to really inspire young people to think, oh, that seems like that person has a really neat job. I think, I would want to do what they get to do. Because I think that's how many of us do feel.
Megan, I agree with you. And if I can just follow up my last thought on this COVID, I think this COVID pandemic that was going to be with us for a while is going to provide us with both a risk and an opportunity. And I would just encourage everybody that is here, young and elder, to go beyond, go beyond the dialogue of nurses being thanked for their participation in caring for people. I think it is very scary probably for young people to be thinking about entering a career in nursing right now. But to go beyond, I hear a lot of people thanking nurses and recognize their importance. But for us, if we can really be promoting ourselves as innovators, as leaders, as people that are guiding our response to the pandemic and keeping our communities safe, as opposed to this perception that we're just the worker bees that are following the doctor's orders. That's the opportunity I leave you with.
Thanks so much, Peter. Minashi, we just have a couple of minutes. I'd love for you to just kind of give us your final thoughts. I think you're the most important member of our panel as the young person. So would love to just have your final thoughts.
Sure. Thank you so much, Megan. And I echo everything that Peter has just said, and really highlighting that the onus is on all nurses in being able to raise ourselves up and empower ourselves, in really changing that perception of what nursing is. And this will help us greatly in being able to encourage those incoming young nurses in seeing nursing as an attractive profession.
Great. Thanks so much. So, really great thanks to everyone for joining us today. I think it was really exciting to hear everyone's perspectives. Thanks for your active participation in the chat. I think, lots of good ideas to think about and actions we can all take to help shift the field of nursing. So thanks so much. Thanks, Peter and Munashi. It was really great to connect with you all.
Thank you.
Thanks, Megan.
All right.